So we are doing fetal alcohol syndrome. So a little bit of the patient's story is mom came in. She's a 22-year-old known alcoholic who is coming in and delivering, and she did not attend any of her prenatal visits. So she saw no prenatal care prior to giving birth. She consumed alcohol daily during her pregnancy. Um, her parents have not talked to her since she left home at 18. There's really no significant family history. She found out she was pregnant at 20 weeks. She reported when she came into the hospital and gave birth at 37 weeks. And then a little bit of the events leading up. So she came in at 37 weeks, gave birth to her first child with no complications. Mom left the hospital and claimed she does not want to care for her daughter, Jill. Her daughter was named Jill prior to her mom leaving the hospital. She's now 48 hours old and is in the NICU since her birth. Social services has been working to coordinate her placement with her grandparents once she's able to be discharged. Grandma Maggie had no idea her daughter was pregnant and had to travel a long way to meet her granddaughter. It's been a long trip, and she has lots of questions regarding her granddaughter, Jill. So basically the nurse is going to sit down with Grandma Maggie and kind of explain what's going on and like what's happening with Jill. So let's get with it. Hi, I'm Kate. I am Jill's nurse in the NICU. I've been caring for her this shift, and I cared for her prior. She's 48 hours old, and I know you had a really, really long trip. So do you have any questions for me?
So someone mentioned on the phone that she was going through withdrawal. What does that mean?
Oh, yeah. So there is a risk of babies going through withdrawal when they come in and their mom has been drinking alcohol during pregnancy. So right now, Jill is very uncomfortable. She is very jittery and irritable. When we go meet her after this, she may be crying. You may hear some sounds from her. She's going to look uncomfortable and she's going to look very tense. So she has increased muscle tone and increased reflexes right now. And you can tell by her vitals that she is uncomfortable. Her respiratory rate is 65 breaths per minute, which is a little high. Also, her pulse is high at 220 beats per minute, and her blood pressure is also high. And it kind of is showing that one of the things is that she's having poor suck, and that's something that we're dealing with through her withdrawal as well.
Okay. So I've always heard that alcohol is bad for babies, but what does it actually do to them?
So there is some long-term complications of fetal alcohol syndrome, and so some of them are like structural changes within the face. So they can have small eyes, a flat mid-face. They have a smooth philtrum, which is like the part above your lips. So this part would be smooth. They could have some eye changes with the shape. They can also have just like eye or seeing problems. They might have some eye issues, and they'll have, again, poor suck, and they could have possible cleft or lip excuse me, cleft or, what is it? I cannot say it.
Cleft palate or lip?
Cleft palate or lip. Thank you. So you've heard of it before.
Yeah.
So they could have that. There could be issues with like her being deaf or heart defects. She actually has what's called patent ductus arteriosus. And
What's
then
that?
what's that? Okay, so that's a heart defect, and it has to do with oxygenated blood that's coming from the aorta, and that basically moves back into the pulmonary artery. It's all very confusing, but it kind of increases pulmonary pressure in the lungs. And so what we're doing for that right now is just monitoring her, kind of making sure she's okay. She has, if you listen to her heart, she'll have a murmur. Right now we're kind of seeing if it will close on its own. It normally closes at like hour 15. of after birth. Hers hasn't closed yet, but we're kind of just waiting. And then possible treatments are we can give a med called indomethacin, which is shown to close it. And then also we could do a very like minor procedure. It's like it's pretty non-invasive, and they just go in and they just clip it closed. So yeah, that's what we're doing for that. Some
She
other
doesn't have all these things, right?
no. These are just possibilities of like long-term complications. So kind of the big one that we're focusing on right now is like feeding problems, which can lead to poor growth and development. Which I know this sounds all very like scary, but I just want to give you a heads up, kind of like what to look for as she grows. But she could again have some like speech and language difficulties, some cognitive issues as she grows, and yeah, kind of some. I think the big thing right now is the delayed growth and development, though, for sure.
So, what are you doing in the NICU to make her comfortable?
So we are giving her some medications, or at least one right now. We have morphine for her, which will kind of help her relax and help with those like her jitteriness and make her more comfortable. So we're doing constant like assessments and pain assessments to see if she needs more. So we're giving meds. We also have what's called phenobarbital that's kind of on hand. And we use that just because these babies who are going through withdrawal are at risk for seizures. So that's the med that we would give if we think they're at risk or if they are having a seizure. And we're just doing lots of assessments, lots of feedings, and we're kind of monitoring her like fluids and her electrolytes and all her labs to kind of make sure she's doing good.
What can I do at home to make her comfortable?
Right now, it's a couple of similar things that we're doing in the NICU as well, is like decreasing her stimulation. So we swaddle her with her legs flexed, and we decrease the lights and the sounds, and we kind of try to like cluster interventions. So that's just kind of like trying to do as much as possible in like a short amount of time. So then you're not like, oh, I forgot to do this, and like constantly coming back and stimulating her. And we're doing lots of feeding. We're using a high calorie formula because she is at risk for those growth delays. And we're doing constant, like, we're changing the nipples on like the bottles to see which one works best for her. Whatever like she'll feed best on, because we want her to get lots of food. We're elevating her head during feedings, and then a little bit after, we're burping her. So that's something you can do at home, all of this. And also putting her on her back to sleep, and most of the time anyways. And that's also something you can do at home. So a lot of this is something that you can do at home by like making a quiet environment and like feeding her, and will definitely help you as she's staying here and giving whatever tools you need to be successful with her.
Okay, so I know we've talked a lot about Jill, but is there anything that can help my daughter too?
Yeah, so we love to catch moms who are pregnant on the labor, like before they give labor, at those prenatal visits, and that could be hard because we don't know. But just there is community services, outreach programs that can help with her alcohol, and there's community, there's hospital, there's a lot of resources. There's through churches, there's not through churches. And I have a lot of information and pamphlets for you if you would like to take some and try to communicate those to her. But yeah, we kind of hope with that is like getting her to stop drinking, that hopefully next time she gets pregnant that we kind of don't have the situation with Jill. So do you have any more questions for me?
No, I think I'm just excited to go see her.
Okay, perfect. Yeah, let's go meet her.